Welcome to the Euro-Mediterranean Economists Association webinar on systemic strategies for exercise adherence toward movement-enabling societies, organized under the Euro-Mediterranean Economists Association role as a pathfinder in the World Economic Forum Brain Economy Action Forum. So this event builds already on our work on physical adherence based on the working group on exercise and the importance of physical exercises for well-being and mental health, in which, in fact, Felipe Isidro and Mr. Trejo, they are partners of this. And also the recent published paper, which is a white paper, which is freely available on our website, coordinated by Enrique del Veramore Martin, who highlights, in fact, the needs to design systemic strategies to integrate and sustain physical activities in our societies. So today we convene, in fact, in a pivotal moment in which physical inactivity and its profound consequences for mental health, overall resilience, and also economic sustainability has emerged as one of the most pressing structural challenges for our times. And this is not only in the Western world, but also in the Mediterranean and African nations. So if we look at the data, and of course we can look at the overall data situations that we try to monitor within our Brain Capital dashboard, which is also freely available on our EMEA website. The World Health Organization tells us that 31% of adults worldwide, almost nearly 1.8 billion people, do not meet the recommended levels of physical activity. And that inactivity is projected to rise up to 35% in 2030 if no action is taken. So this means that these are really, I would say, reference estimations. Of course, 2030, it's in 5 years from now. And if nothing is done, these numbers will increase dramatically. Now, of course, if we look at it among adolescents, the situation is even much more alarming, with 81% fail to meet activity recommendations. So, of course, again, this means that we have much more data on Western economies. That I'm sure that in other countries where, for example, the data is not so much available, the data is much more alarming. Now, the consequences are important to highlight. Inactive adults face 20 to 30% higher risk of premature death. Moreover, inactivity could cost public health systems up to 300 billion between 2020 and 2030. Again, these are estimations based on the numbers that are given by the World Health Organization. So at the same time, if we look at the global context, in fact, we are living in a multi-crisis, polycrisis, as we called it already, in terms of the geopolitical volatility, leading to pressures in terms of the socioeconomic situations of many countries and many segments of the populations, plus the aging demographics and also the strained impact on social protection systems in the Western countries and also in other developing nations, which in fact leads to a higher challenge from public policy perspective and economic policy perspective that we need to look at very, very urgently. Now, if we look at the Western economies particularly, the population structures are undergoing a dramatic shift. These are the inversion of the population pyramids, which in fact undermines specifically the social protection systems and the social policy overall. And this is very important in the next years because countries will not be able to maintain its economic stability if eventually the liability in terms of social protection and social aspects will increase over time. So this is really a challenge that countries will have to deal with in the next few years. Plus, if we look at the data, this also means that if the demographic situation continues, and then obviously the liability in terms of the cost of health will increase, then eventually this will have implications on the grades, the economic grades of those countries. So in response, we know that many countries in Europe are extending the working lives. According to the OECD data, 23 out of 38 member states are raising the retirement age, often without sufficient emphasis on the quality of life. And this is also essential going forward, because obviously some countries like France, even Spain and others have been really quite pushing into this increasing of the retirement age, despite the social policies in those countries. Again, quantity-based life expectancy gains alone are not enough, clearly, without the physical and cognitive capacity to remain active and also productive while having a good quality of life. Obviously, extending working lives risk becoming extending period of frailty. And this is also something that we need to look at very carefully. So the challenge is not merely longevity. Longevity is very good in terms of quantity-based measures, but keeping up with longevity is essential for our populations going forward. So quality measures, quality of life measures are very essential here. Now, looking at the advances in terms of technological and also medical, these have been quite tremendous over the last years, last decades, and they have impacted increasing life expectancy overall, but not necessarily in terms of the improving mental health and also physical health. So we still see trends of sedentarism, poor nutrition, particularly in terms of the processed food, that there is clearly now evidence that processed food have negative implications on our mental health and overall health. We had a webinar in June where some of you, George, was part of it, and was clear to us that action is needed in that sense as well. But beyond this, I think the pollution, the data on environment, I think this is also creating a lot of strains on our physical and mental health. The data is already there, the evidence is there. And also our environments have been quietly optimized for comfort rather than sustained movement, which leads in reality to more vulnerabilities, physical vulnerabilities that we need to see it in terms, for example, of a decline in strength, endurance, function, increasingly detected, particularly for young adults. So modern lifestyles, therefore, they in a way has been improving a lot over the last years, but then they are in a way countering our biology, which means that we need to be always in constant movement, and also in constant challenge to ensure that our physical and mental capabilities continue to improve. So looking, for example, in our health system, public health system, up to today, they are more reactive rather than proactive, and they are still really favoring treatments and medical interventions rather than prevention. And I think the role of prevention is essential, particularly in terms of the adoption of lifestyle-based preventive strategies. And these are all nowadays quite recognized within the community of medical neuroscience and also other type of experts. that they lead to, in reality, savings to the social protection systems and medical systems that we need to keep looking at those. So today's webinar is quite important, it's very timely, and moreover, it comes before our next meeting at the UN General Assembly in New York in September, while also George with us today will be part of it and others. And I think we will bring today this discussion about to what extent physical exercise is essential and how we can make a systemic change for us to integrate in our style of life, and at the same time use it as really a prescription, not only for prevention, but also for treatment. So our aim, in fact, is to design practical frameworks to foster this cross-border collaboration, not only here from Spain, but also in the US and other countries in Africa, to allow us to move from a reactive medicine to proactive movement-centered prevention and treatment. And this will be the foundational for healthier, more resilient, and more productive societies. So our webinar today will discuss these aspects, and I'm very happy to have you all here today to discuss these very important questions. And I would like to start already by inviting Enrique de Belamore. He is member of the EMEA expert panel here in Barcelona. He is expert in strategic advocacy and intergovernmental cooperation with a focus on promoting physical activity as a key tool for preventing and treating metabolic and mental health conditions. So Enrique has been also the director of UN UNEP MAP Center, UN Center here in Barcelona, where he has been working on strengthening this cooperation between different governments, and also in the field of sustainability and pollution prevention across the Mediterranean. So also, Enrique has been leading the work of the working group, which is Exercise Adherence for Well-being, and we have been working together for 1 year last year to work on particular recommendations for future action. So, Enrique, the floor is yours.
Thank you very much, Srin. I will be first starting to go very shortly through the, let's say, the contents of the white paper that you mentioned on adherence for well-being and for physical exercise. In that sense, the paper, on the one hand, makes a collection of scientific evidence on the benefits of exercise for physical and mental health, like neuroplasticity, mood regulation, prevention of chronic and neurodegenerative diseases. As well, in another chapter, there is an analysis of the barriers, the main barriers, for both the initiation and also the maintenance of adherence to physical exercise practice, in that sense, covering different types of reasons. On the other hand, also there is a showcase of international case studies illustrating different cases on how to integrate physical exercise in different aspects of life, and also in the, let's say, the different aspects of society. For example, healthcare systems, schools, policy and regulatory frameworks, like outdoor spaces, as well as workplace and insurance incentives. And finally, the document provides a number of recommendations on different types of strategies and suggestions or proposals for further research to advance knowledge on exercise adherence. The main target of this document are mostly policymakers, healthcare institutions, and community leaders that are in charge of fostering environments that actually support mental health and well-being through physical activity. One of the main takeaways from the white paper is that adherence to the practice of physical exercise is not simply a matter of individual willpower, but is actually, as all of you know, shaped by social, cultural, and environmental determinants. And in that sense, structural, environmental, technology factors as well shape movement in human beings. That means that currently, in this era in which we are entering on with AI, we're going to see further reduce the need for physical effort at work, home, and in general in social and life, both professionally and also personally. In this framework, we see this pattern be probably accelerated in next future, as for example, in issues as you know, related, for example, to the progressive replacement of human beings and different works of human beings by automatization through AI. And in that sense, there is a debate in many countries about the launching in the future of even the idea of universal pensions. So that will mean that for a considerable number of people, there will be less need to work, less hours, and accordingly, also probably less need to move, to go to work. According to evolutionary psychology, expanding the spare time may intensify sedentarism in that sense, especially in a screen-heavy, comfort-rich or society settings. Extra time often would default to passive leisure. So the question is that in a society shaped by obesogenic environment and technology dependence, is it actually illusionary to address physical exercise as a matter of individual responsibility? Let's go through different, let's say, factors that would put this in doubt. For example, everyday headwinds, basically what we understand as going against the grain. I mean, trying to establish a strong habit of physical exercise means to go against what normally society considers as normal. It's normal to have a poor diet, a poor food diet. Alcohol use and sedentary routines are also normalized. On the other hand, those people that try to work hardly in establishing this habit for physical exercise also there's other kind of challenges, which are, for example, the unrealistic aesthetic ideals that are amplified by social media. On the other hand, as you all well know, personally as well as we, there is a constraint regarding time scarcity and also cognitive load, which creates anxiety, mental fatigue, and loss of motivation. Also, we can see that there is an unfavorable food, environment, and economics. We are witnessing a continuous rising of fresh food prices versus the continuously more abundant, cheaper, ultra-processed options in different retail settings. And in all this kind of, let's say, framework, we also face another, let's say, uncomfortable truth, which is that the existence of even distortions in the fitness market. So that means that in many cases, low-cost gym economics rely actually on over-subscription and absenteeism. So basically, intentions really become routines. Another way to refer to this, sometimes the business case of the big gyms are about keeping people paying every month, but without going to the gym. And last but not the least, we are, of course, seeing that there is a great, let's say, opportunity and benefit coming from the technology in the shape of digital health devices. But there are also pitfalls with regard to this new reality about digital health and wearables. If both smartphones or wearables are used not in a proper way, they can drive bodily hypervigilance, health anxiety, and compulsive checking, as you know. And in that sense, also screen-centric leisure displaces movement. So, because of these different elements that somehow are shaping our current society, and in that sense, challenging the possibility that most of the population can establish strong, let's say, habits in physical exercise during all their lives, is why we have invited you to discuss on different questions related to the possibility of reframing the challenge of adherence, not as an individual behavior, not as an individual responsibility of population of the person, but as a structural and cultural issue. So this is why, based on your suggestions, we are going to later on have a discussion focusing on these type of 4 questions. How can public systems support conscious physical movement and exercise? Can we actually redesign environment schedules and social norms so that physical capabilities are cultivated and preserved across the lifespan? What role can neuroscience, digital tools, and behavioral science play in fostering a systemic change to a society that integrates conscious physical movement and exercise as an integral part of their life? And last but not the least, what opportunities does a systemic shift toward daily movement and exercise create for entrepreneurs and the fitness and sports industry to develop new scalable business models? So later on, we'll be able to guide you a little bit on how to structure the discussion. Thank you very much.
Thank you very much, Enrique. This is a good overview on the basis of what we have worked together on the working group, and you raised very important questions to our panelists today. So I would like to, without further ado, give the floor to José Luis Trejo. José Luis, he's a director of Lifestyle and Cognition Group at the National Research Council of Spain. He has published a lot on the connection between neuroscience and physical activities and stress and improving cognition. So, José Luis, the floor is yours. Thank you for being with us today. You are muted. Yeah, unmute yourself, please.
I think it's happening like...
Yeah, you need to unmute.
Now, hello.
Ahora, sí. Yes, please.
Perfect. Thank you very much, Rima and Enrique, for your kind introduction. So it's difficult to focus in a so complex matter than this, just to focus. So I will try to be very concise in focusing in 3 points, all around neuroscience and physical exercise. The first thing I want to say is that the neuroscience has demonstrated that the protocols generating very high adherence have the following characteristics: high frequency, at least 3-4 times per week, the training, a reward strategy for achieving goals, and a training that is highly progressive, starting very slowly and gradually accelerating. And that this training lasts at least 3 weeks. Much better if it's 2 months, obviously, but 3 weeks is enough. And the reason is the neuroplasticity and the reorganization of neural circuits that occur especially between the prefrontal cortex and the striatum. Okay, so second point is that all this is useless if relevance is not introduced into training regarding how much, when, and even where the training is done. We know now that too much exercise is as counterproductive as no one at all. It's an inverted E curve, and you have to do it as a moderate or vigorous intensity, but never strenuous. It's also important that need not to be too long, as this can lead to stress. And the more natural environment, the better. If possible, outdoors or in a natural environment. All of this leads to the most important point of all, that is the personalization of exercise. But the more relevant point to me is the third point. Finally, all of this is very easy to say, but harder to do, because to achieve this, a person must have to manage their time and the mental capacity to do the training. As the latest European Union Eurobarometers indicate, for a very high percentage of the European population, we are talking about millions of people, they don't have enough time to do their work days, which leave them coming home completely exhausted and unwilling to do even basic tasks and family care. This is the data from the European Union, as well as stress due to the enormous increase in the complexity and responsibility of the task. Even despite the reduction in the number of hours in the work week over the last 25 years, people have neither the desire nor the time to do all of this. So this last point is a global social task. We're not just talking about exercise, we are talking about mental health. If we don't approach mental health from an holistic perspective, we'll never be able to require people to exercise, no matter how good it's the exercise for the brains, or no matter how many benefits we tell them in educational tasks about exercise. This holistic approach must combine exercise, diet, sleep, and stress reduction. This is the role of the lifestyle neuroscience have to do. Otherwise, we will have achieved nothing. This last consideration necessarily requires a global social consensus so that companies, especially companies, but also public institutions, can rethink the pace of life they are imposing to tens of millions of people in Europe and around the world. So if we don't have time to do the exercise, and we don't have the motivation and the time to organize ourselves, it will be very strongly difficult to have time and willing to do exercise. And this is the role that I think that the lifestyle neuroscience have to do. So these are very, very, very briefly the three main things. So the first was that the neuroscience already knows how to do the adherence of a neuroscience, but for that time, we have to personalize the exercise to everyone. And the third point is that we need to put time in the hands of the people. This is my message.
Thank you, Jose Luis. This is very clear. And of course, this means that we need to completely rethink the way we organize our schedules and how we work, how we live, embedding the lifestyle changes in our way, or I would call it a new way of quality of life. Obviously, this is quite, a change of paradigm that we need to start thinking of. What does it mean, in fact, in terms of economic policy, in terms of competitiveness, in terms of productivity, in terms of our economic efficiency? This is all questions that I will, we have to think about, and probably ask also Georges later on to give us some ideas how he sees this. But before we go into that discussion, I would like to invite Mitchell Elkin. Mitchell, he's Chief Clinical Science Officer at the American Heart Association. And of course, these aspects are essential for our health, heart health. So without further ado, Mitchell, the floor is yours.
Perfect. Well, thank you so much, Dr. Ayadi and EMEA, for giving me a chance to speak on behalf of the American Heart Association about this important issue. And really, thank you for those terrific introductions of the topic. I don't think anything more needs to be said about the importance of physical activity or, these crucial aspects of the neuroscience behind it. I thought that was really helpful framing. I've been asked to speak a little bit about physical activity as a clinical intervention within the healthcare system. And I think that the way we approach it, though, is very much aligned with the points that have just been made about how important it is for physical activity to be seen within the holistic aspects of health and connected to other health-promoting behaviors like nutrition and diet and keeping clean air and so forth. So I thought what I would do is talk a little bit about something called the Physical Activity Alliance, which is an organization of different organizations here in the United States that really emphasizes the importance of physical activity and how we can go about increasing physical activity and adherence to physical activity over time. And the American Heart Association does play a role in the administration and advising of this organization. But you can see this is really, again, an organization of organizations with many different large professional societies societies, physical activity organizations, and so forth involved in it. And as I was listening to some of the comments before, I was thinking that we probably do want to expand to some other types of organizations, whether they're economic or neuroscience or architecture, urban design, and so forth, in light of the points that we'll make today. The Physical Activity Alliance really has three main pillars to it, if you will. One is the National Physical Activity Plan that I'll mention in more detail, but we also address policy and systems change and then professional development as well. With regard to the National Physical Activity Plan, you can see here that it's, again, really a multidisciplinary, multi-sectoral approach to improving physical activity, including business and industry, community, recreation, parks, educational institutions, faith-based settings like churches and synagogues and mosques, healthcare itself, which we'll talk about more, media and communications, military, very important, public health, of course, sports, and transportation, land use, and community design as well. Within the context of healthcare, which again was the focus for me here, this involves clinicians, but also insurers and health systems more broadly. There are four main strategies with regard to healthcare for this National Physical Activity Plan: prioritizing efforts in healthcare to promote physical activity, collecting evidence to recognize and prove that physical inactivity or insufficient activity, a sedentary lifestyle, are preventable and treatable conditions, and that they have clinical healthcare outcome implications and cost implications as well. Also, that healthcare would need to partner across sectors to improve access to physical activity, especially for disadvantaged populations, and importantly, to expand education on the importance of physical activity in the training of healthcare professionals. So first, with regard to this idea of how do we prioritize efforts within the healthcare system to promote physical activity? A systems approach is crucial. There has been an effort to develop what we call a physical activity vital sign that doctors can collect, and I'll show you an example of this in a moment, then to integrate that into the electronic health record so that we can track it over time in individuals and in populations, to make that vital sign a quality measure for healthcare systems, and even an incentive measure in what, at least in the US, we refer to as value-based healthcare or accountable care organizations that aren't paid strictly on a fee per service basis, but on the improvement of the quality of care of their populations. And then integrating data from wearables, smartphones, other things, and showing an impact on clinical outcomes, and recognizing healthcare providers who do particularly promote physical activity. So there's a particular campaign called It's Time to Move, which focuses on how we get physical activity assessment, prescription, and referral into the clinical scenario. And here's an example of how we can assess people. This is through an initiative called Exercise is Medicine. Right? And the idea here is that a physical activity vital sign would assess weekly physical activity levels using the questions that you see there. On average, how many days per week do you engage in moderate to vigorous physical activity, like brisk walking? And then how many minutes do you do it on a day? And then you can calculate the number of minutes per week. And then based on that vital sign, if you will, a prescribing doctor can look at recommendations based on a patient's age for how much physical activity they should have, both for aerobic activity as well as muscle strengthening activities, and then create a prescription for the patient that tells them how many days a week. And again, personalizing it, as we just heard from Jose, but in terms of frequency, intensity, types of activities, and so forth for both aerobic activity and strength training. And then Also, to be able to refer patients to individuals with expertise in exercise physiology and exercise, and it would depend on the individual's baseline level of risk. Are they an otherwise healthy person? Do they have chronic disease, and so forth? And there are different levels of expertise professionally that would be relevant to that. Of course, at least in the US, I assume similar in most countries in Europe as well, none of this happens if doctors can't bill for it. And so it's important to then have diagnostic codes and billing codes that we can use so that physicians and other providers can refer patients for these treatments. Secondly, the second strategy I mentioned was recognizing that physical inactivity and insufficient activity are preventable and treatable, and that they have health and cost implications. And so here the idea is to try to gather evidence showing that encouraging patients to engage in physical activity can have measurable improvements in health outcomes and cost benefits as well, and also to establish the workflow that can allow this to happen. And to achieve this, it really takes more than just telling people to do to engage in exercise. And here I'd like to borrow a little bit from my close colleague Kevin Volpe, who's a physician but also health economist at the University of Pennsylvania, and has been working with us on our Healthcare by Food, or Food as Medicine initiative. But much of his work on behavioral economics and how you get people to change their behavior and adhere to physical activity is relevant as well to physical activity. And so, first of all, there's the idea of using nudges, right? So a nudge is a way that you can change the choice architecture that patients face in order to make them more likely to engage in a particular behavior. So, for example, if you put healthier food first on the menu, people are more likely to order it. If you make the default option a 90-day prescription instead of a 30-day prescription, a physician is more likely to give a person a longer prescription that they would then not need to renew as often and run the risk of missing their medication, and so forth. And there's evidence that nudges can be successful in improving people's participation in healthcare programs. For example, simply opting in versus opting out. Opting out can increase the likelihood that people will get prescriptions filled, for example. Similarly, financial incentives can play an important role in getting people to engage in physical activity. We know, for example, that as soon as sugary beverage taxes were introduced in Philadelphia, the likelihood that people would consume those beverages decreased 38%. So people go where the money is. The same is true for physical activity programs. So in a nice clinical trial that was conducted by Kevin and colleagues, they showed that engaging people in a social activity, gamification, where they're competing against others to participate in physical activity, the number of steps that they take increases, and the proportion of patient days that they achieve the step goals increases as well. And so we can, by giving people social incentives, they can engage in more physical activity. And in a follow-on study where, in addition to gamification, they also added a financial incentive, they found that both the social gaming and the financial incentive increase physical activity, that is the number of steps people took in this graph here, and by combining them together, the effect was even greater, and the benefits persisted after the end of the intervention as well. So something is learned in that process, to the earlier points from Jose, that persists for a longer period of time. So it's important, couldn't agree more, important to keep it simple. Immediacy of feedback is important. The amounts that are provided and financial incentives need to be sufficient to change behavior. Sometimes a small amount can be worse than doing nothing. The incentives need to be salient, We need to collect clinical evidence and use these and other behavioral economic principles for effectiveness. In the interest of time, I think I will stop right there. And thank you for your attention and look forward to the discussion later. Thanks.
Thank you, Mitchell. This is very comprehensive and it gives really a clear view on which are the incentives to increase healthy physical activities. I have one question before we move to our next speaker. You mentioned that there is a national physical activity plan applied in 10 sectors. So is it the same type of strategies and tactics that are used in other sectors, or you have a diversified strategy for each type of sectors?
Yeah, very much so. There are different strategies and tactics within each of the sectors, and the plan has just launched within the last couple of years. So they'll be collecting data, and I think over the next few years, hopefully we'll begin to see results from it. So we can report back on those in the future.
Thank you very much. And then this data is available publicly, or we need to get in touch with the association to allow us to see how we can collaborate on this element?
It is available publicly, and I can put that in the chat at least, and I'm sure we can make it, available to the audience.
Fantastic. Thank you, Mitchell. This is very helpful. Our next speaker is Felipe Isidro. Felipe, he has also been a member of our working group and one of the key partners in this white paper. So thank you, Felipe, for being with us. Felipe, he's very well known on physical exercise. He has a lot of involvement within Spanish ecosystem on improving physical activities at different levels. So thank you for having this contribution today. Felipe, please, the floor is yours. One aspect, one details I want to share is that Felipe will speak in Spanish language.
Mm-hmm.
So later on, my colleague Paula Pasos will do a translation, but not simultaneous, but rather right after. So she will give an overview in English language after you. So please, the floor is yours.
Okay, thank you very much for the invitation. Sorry, but my English is very poor and I'm really speaking in Spanish. Paula will translate into English. Thank you. Paula, are you ready?
Yes, I'm ready, Felipe.
Okay.
When you want.
Thank you very much. Bien, ¿por qué vidas activas? ¿Por qué estilos de vida activo? Pues básicamente por los números que nos dan de sedentarismo. El 50% de la población mundial tiene sedentarismo, el 81% de adolescentes no cumple las recomendaciones y por lo tanto hay un número muy alto de muertes, un 5,3 millones de muertes por año. Por lo tanto, como punto clave, no se trata solo de alargar la vida, sino de ensanchar la vida.
All right, so why physically active lifestyles? WHO estimates that 81% of teenagers fail to meet the recommendations, and over 50% of the world's population is sedentary. Sedentarism is correlated to a very high death rate of 5.3 million people each year. And these physically active lifestyles have at the core the objective of not only lengthening life, but also widening it.
Okay. Los nuevos medicamentos son una oportunidad. Tanto semaglutida como tirzepatida es cierto que reducen la grasa corporal, pero también causan una disfunción muscular. Y eso que parece algo negativo, debemos entender que necesita un complemento y es una adecuada nutrición con suficiente proteína y sobre todo hacer ejercicio de fuerza y cardiorrespiratorio. Por lo tanto, es una oportunidad porque la gente que pierde ese peso graso se encuentran mucho mejor y están más animados para realizar ejercicio. En definitiva, la idea clave es que independientemente del peso, el sedentarismo significa una disfunción muscular.
So some new drugs offer new opportunities, specifically semaglutide and tirzepatide, which reduce body fat. However, they do cause also muscle dysfunction, which means that these drugs must be taken as a complement to adequate nutrition, aka sufficient protein intake, and also strength and cardiorespiratory exercises. So therefore, they do offer the opportunity. Also, it must be taken into account that after weight loss, people are more motivated and willing to exercise. But so yeah, at the end of the day, sorry, regardless of weight, the idea is that they are an opportunity, these new drugs, with the adequate complements, and sedentarism it's always equated to dysfunction.
Y aquí habría que diferenciar tres conceptos. Uno es el de actividad física, que es el hecho de movernos cada día. Otro es el ejercicio físico, que es algo pautado, reglamentado. Y por último, deporte. Está claro que la recomendación de moverse en general puede ser una recomendación bien hecha, pero difícil de realizar. Por eso aparece el ejercicio físico. Y por último, el deporte tiene algo de competición. Por eso hay que estar en forma para hacer deporte y no hacer deporte para estar en forma.
All right, so here there's a distinction between three forms of activity. There's first physical activity, which is everyday movement. Then we have physical exercise, which refers more to some guided training, some general guidelines. And then we have sports, which have this element of competition. And they are distinct spheres, but correlated.
Bien, y aquí tenemos el problema estructural de la actividad física, de movernos en nuestra vida diaria. Tenemos un gran problema porque vivimos en un entorno obesogénico, sedentario. Eso hace que la opción de hacer actividad física muchas personas la consideren una opción recreacional, no una necesidad para su salud. Pero también tenemos que tener claro, por lo tanto, que no es una decisión individual, depende también de un entorno, de una estructura que se lo permita. Por lo tanto, el punto clave sería que hoy en día es necesario hacer más de lo necesario.
Mhm. So the big problem that we have currently is that we live in an obesogenic environment, a sedentary environment that frames physical activity as an option. So many people don't view it as a need. However, the challenge is not just up to each individual, but rather to create the necessary structures to allow for individuals to move more. So it must be framed as a necessity and not just as an option.
E independientemente de todas las oportunidades y todas las acciones que tienen que realizar instancias superiores, desde gobiernos hasta instituciones, lo que sí que tenemos que tener claro es que para que eso se pueda realizar necesitamos una demanda social y por lo tanto esa demanda social debe ser la que inicie ese proceso de cambio de ese entorno por los agentes que tengan que realizarlo.
So independently from all the actions that governments can take and at a policy level, it is essential that there is a need, a social demand for these changes to happen. It must come from the general population.
Y por tanto, tenemos que crear esa necesidad de la gente. Tenemos un gran problema. La gente no ve necesario hacer ejercicio generalmente hasta que ya no puede levantarse de una silla. Por lo tanto, ¿por qué? Pues porque vivimos en este entorno tan fácil, ¿no? Entonces, una de las propuestas debería ser la obligatoriedad de pasar una prueba funcional en diferentes edades para que las personas se evaluaran a nivel físico, a nivel funcional.
So we therefore must create this necessity on general population. This lack of need, as we mentioned, it's because of the easy environment, the environment that allows for this poor physical function to persevere, and therefore a proposal that could prevent that from further developing would be to establish mandatory functional evaluations from school to primary healthcare to make people aware of their need to increase their movement and their physical activity.
Por lo tanto, solo evaluando podemos crear esa necesidad. Si no, las personas no van a entender la necesidad de hacer ejercicio. Debemos normalizar no ser normales. Solo evaluando podremos crear la necesidad.
So just evaluating, we can create this need, and we must normalize not being normal for this to prosper.
Y simplemente os quiero presentar aquí algún par de pruebas muy sencillas para que veáis que son muy rápidas de hacer y muy fáciles de hacer. Por ejemplo, la prueba de levantarse 5 veces de una silla lo más rápidamente posible. Aquí tenéis desde los 20 años hasta los 90 años qué significaría estar mal de rendimiento físico, es decir, mal en fuerza de piernas, normal o lo óptimo, es lo que tendría que tener todas las personas en función de su edad y su género.
So here there are a couple tests just for you to see how easy it would be to evaluate individuals. Here there's a test of the 5 repetitions, sit to stand, from a chair. It's basically 5 repetitions of standing up from a chair. And you have some values of what an optimal physical condition would be from age 20 to 90.
Os pongo un ejemplo. Aquí tenéis a Margaret con 78 años que le hicimos la prueba de levantarse de la silla y solamente podía levantarse una sola vez, es decir, estaba próxima a la pérdida de autonomía. Le hicimos un programa de ejercicio muy sencillo, aunque aquí veis que es en el gimnasio, hizo varias sesiones en casa, de 5 semanas, 10 sesiones. Y la misma persona, aquí la veis haciendo los 5 repeticiones en 7 segundos, ¿no? Eso es mejorar la calidad de vida.
That's the example of Margaret, who could only stand from her chair one time, so she was close to the loss of autonomy. And through strength training sessions, she managed to dramatically increase her quality of life.
Y aquí tenéis otra prueba. Hemos visto una prueba de fuerza de piernas. Esto será una prueba de capacidad cardiorrespiratoria. Se necesitan únicamente 30 metros y se trata de caminar el máximo número de metros en 6 minutos. Y aquí podemos perfectamente, desde los 40 años, aunque también hay tablas de anteriores edades, también saber cómo estamos de capacidad cardiorrespiratoria sin ningún material y con una prueba muy fácil de usar.
That's another test. It's a 6-minute walk. So it's a cardiorespiratory capacity testing evaluation. And it is about walking the maximum number of meters possible in 6 minutes, which can also be used for the evaluation of the physical condition of individuals.
Gracias. Por lo tanto, de lo que se trata es hacer que la gente que tenga esa necesidad y luego hacerlo muy sencillo. El principio de Pareto, con un 20% de esfuerzo podemos lograr el 80% del resultado. Se trata de que un primer paso no te lleva a donde quieres, pero te saca de donde estás.
So it's about, at the end of the day, people having that need that we talked about. We have this, based on this Pareto 80-20 rule, which means that 20% of effort, can lead to 80% of results. And at the end of the day, a first step won't take you where you want to go, but it will take you out of the current space.
Y por lo tanto tendríamos programas de entrenamiento o de ejercicio muy accesibles, de bajo costo, donde no hay ningún tipo de herramienta, que puedan integrarse en la vida diaria, que sean muy simples y que sean variados. De esa forma podemos lograr que las personas se adhieran mucho más fácilmente a la posibilidad de realizar una pequeña dosis de ejercicio físico.
So we would create physical training programs that are low cost, with not a lot of material, easily accessible, and that can be integrated into people's daily lives so that it promotes exercise adherence.
Y algunos ejemplos, ¿no? Podemos hacer desde snacks de ejercicio, de 1 o 2 minutos, pues lavándote los dientes, bailando algo mientras estás limpiando la casa, mientras estás viendo la televisión, subiendo escaleras, moviéndote con la familia. Es decir, hay diferentes soluciones que se pueden integrar muy fácilmente en nuestras actividades diarias.
So we have examples of accessible habits like exercise snacks. As you can see, they can be easily integrated into daily life, like doing star jumps while ad breaks appear on TV, or doing squats while brushing teeth. And at the end of the day, it's different solutions that can be adapted to a lot of daily life contexts.
Y aquí os presento algunas cosas en cuanto a ejercicio, programas de ejercicio más estructurados, en un formato de vídeo, que sean muy sencillos de realizar, que el paciente los pueda ver a la vez todos los ejercicios y que pueda también seleccionar aquellos que mejor le funcionan en relación a su contexto y a su forma física.
And here, there's an example of video programs, exercise video programs that patients could watch and replicate according to their needs and their home situation as well.
Y ejercicios que además han de ser adaptables a cualquier situación personal y a cualquier limitación personal. Aquí tenéis algunos ejemplos para personas encamadas o personas que solo pueden realizar ejercicios sentados.
And these exercises must be also adaptable to any personal limitations, like for instance, people that are bedridden, they can also do some exercises.
Y también, por último, la sociabilización, algo muy importante. Es decir, y sobre todo en personas mayores, el hacer ejercicio junto con otras personas también favorece la adherencia.
And in older people, exercise adherence is enhanced with this social component of exercising together in a community.
Por último, y ya digo los puntos clave, las estrategias serían diseñar programas reales, es decir, algo que realmente no sea lo ideal, sino sea lo real. Promover entornos evidentemente activos, ciudades activas, espacios verdes, lugares de trabajo activos y que posicionemos el movimiento como un real derecho de las personas.
So key points include designing habits that are that fit real life schedules, not just the ideal ones, promoting active environments through cities, active workplaces, and also framing movement as a public health right, not just as an option.
Y la última llamada a la acción sería que el cambio no depende tanto de la dependencia individual, de la voluntad individual, como sí de las políticas, de la planificación, sobre todo en educación y en sanidad, para normalizar el movimiento. Generalmente con legislación, legislando. En general, tenemos que promocionar más la vida, la posibilidad de tener una vida activa que no la obligatoriedad de hacer ejercicio, ¿no?
So at the end of the day, willpower, individual willpower is important, but we do need a more systemic approach. We need to change policies, especially in education and healthcare, that normalize and promote movement.
En realidad, se trata de saber que el movimiento no es una opción, es una necesidad biológica y vital. Aquí tenéis también os he dejado un código QR por si queréis repasar esos vídeos que hemos visto, esas herramientas prácticas y las podéis utilizar en algún momento. Gracias.
So at the end of the day, it's about framing movement as not as an option, but rather as a biological need. And here you have a QR code in case you want to know more information and check the information presented in this presentation. Thank you very much. Thank you, Felipe.
Muchas gracias.
Thank you very much, Felipe and Paula, for very clear translation. Just one comment I wanted to make, and I completely agree with you, Felipe, on the importance of healthy cities. I would even call them active cities, which are essential for, I would say, better living, better active living, rather than having exercise as a kind of a prescription for a specific purpose. So if we have healthy, active cities, which is the basic infrastructure for us to move, then most probably a lot of what you're saying is becoming really a reality rather than just wanting to move because there is a need to move, in fact. So I would like to move to our next speaker. I don't see him on screen. George Vradenberg. He's the founding chairman of the Davos Alzheimer Collaborative. Perhaps he will come back to the screen. I don't know.
He just sent a message saying that he had to take another call, I think.
Okay, so I don't have access to this, so no worries. So I would like now to move right away to the panel discussion and the brainstorming here. And I give the floor to my colleague Enrique to follow up on the discussions, please.
Thank you very much, Rim. So I will now show to you a suggestion, the structure and the flow for the panel discussion. Sorry, because I was trying to adapt and then to change the timing. Anyway, okay, so okay, so I was mentioning before. Okay, great. Okay, so as I was saying before, these are the 4 questions that you finally choose out of the different 10 proposals of questions that we were making for the discussion. So just in order to repeat to you so that you can keep them in your memory, on the one hand, how can public systems, healthcare, urban planning, education, workplaces, support conscious physical movement and exercise in our daily routines and habits? On the other hand, can we actually redesign environments, schedules, and social norms in public spaces, workplaces, and homes so that physical capacities could be cultivated and preserved across the lifespan? On the one hand, what role can neuroscience, digital tools, and behavioral science play in fostering a systemic change to a society that integrates conscious physical movement and exercise as an integral part of their life? And last but not least, what opportunities does a systemic shift towards daily movement and exercise create for entrepreneurs and the fitness and sports industry? So in order to structure the discussion, I would suggest that we do as follows. Let me just see. Now this must be changing to the other. Anyway, so I will just read it for you. So each speaker will be having 5 minutes to go either through all the questions or to pick some of them. I will be, in that sense, giving a signal when 30 seconds remain. And after, let's say, each intervention of each speaker, we will give also a total of 5 minutes for an open discussion, so that the other speakers can react to the different interventions that the colleagues made. So we'll be starting with José Luis. So José Luis, the floor is yours.
Yeah, well, I would say that besides an opportunity, the structural and cultural issue for me is a barrier. So it's the main barrier. So our first target in this point would be the city halls, the city governments. So we are all convinced of the many benefits of the exercise. And most of the people outside, not all, but most of the people outside are convinced of the benefits of the exercise. The problems are the cities, the problems are the companies, and the problems are is coming from the workplaces. So we have to convince these people. These people would be our first targets. This is the one I have to say to begin.
Thank you, José Luis. So I will now pass to Michelle Elkin, please. Floor is yours.
Sure, thank you. Yeah, I guess I would say, fundamentally, the way I see it is that individuals exist in society, of course. And we know, just as an example, we know that only about 10 to 20% of healthcare outcomes are due to what happens to an individual when they're in the office with their physician. More than 80% is due to what's in the environment around them, where people live, work, play, pray, and so forth. And that's why it's so important to focus on the entire environment to make changes, because that's where the action is essentially. And, the bad news, right, is that sedentary behavior and a lack of physical activity is contagious, right? If you hang out with people who don't exercise, you won't exercise either. But the good news, of course, then, is that exercise, physical activity, is also contagious. And so we know that developing the right social networks, and, for example, if you have partners with whom you can exercise, then you're more likely to engage in sustain exercise. So forming those relationships with others who want to share the same kinds of activities, and then expanding it up through the community, the society, the city halls, the parks, all the opportunities, making more and more networks available is a way to improve it. But it's not easy because it does take a village essentially to make it work.
Thank you, Mitchell. So now, please, Felipe, floor is yours.
Bueno, yo estoy muy de acuerdo con mis compañeros. Está claro que la planificación urbana es clave para diseñar ciudades que invitan al movimiento, ¿no? Más zonas peatonales, más carriles para bicicletas, parques, transporte público.
So I agree with everything that my colleague said. Urban planning is essentially key to invite the population to move and increase their physical exercise.
Y en educación, buscar cantidad y calidad de la educación física. En España estamos luchando por 1 hora de educación física al día.
And in education, it's crucial to fight for the quality and quantity of physical education in schools. In Spain, we're currently fighting for 1 hour of physical education per day.
Y por último, los lugares de trabajo, donde debe haber una legislación que obligue a las empresas a disponer, que los trabajadores dispongan al menos, estamos luchando en España por 1 hora a la semana para poder realizar ejercicio dentro de su horario laboral.
And also in the workplace, this must be applied. In Spain, we're currently fighting for 1 hour per week so that workers can do physical exercise within their working hours.
Y por último, creo que hay una oportunidad para muchas empresas y emprendedores. Hay modelos de negocio centrados en bienestar corporativo.
And then there's an opportunity for companies and entrepreneurs for business models focused on corporate well-being.
Mucha tecnología para hacer ejercicio a nivel personal y que sea accesible.
A lot of technology for doing accessible physical activity at an individual level.
Viajes de turismo activo y por lo tanto viajes de turismo para poder hacer ejercicio.
Trips for active lifestyle tourism.
Y, por ejemplo, diseño de espacios y mobiliario en oficinas que permitan el movimiento.
And then, for instance, space design in offices so that they can allow for movement to take place.
Thank you, Paula.
Thank you, Felipe.
Thank you very much, Felipe and Paula. And now I would like just to invite if any of you would have any reaction or comments on the former intervention from your colleagues. If not, I will have some questions to make. I see, yeah, Mitchell, please.
Yeah, so I'll make a comment. So I know we have some folks with expertise in the brain and neuroscience here. I'm also I work for the American Heart Association, but I'm actually a neurologist, a stroke neurologist. My goal at the Heart Association is to increase our work around the brain. And so, we talked before just now about how the person exists in society. I'd also like to suggest that the brain exists in a body, and we can't think about the brain in isolation from the rest of the body. We hear a lot these days about, brain health and how cardiovascular fitness and exercise can improve brain health, reduce the chance of dementia, neurodegeneration, and so forth. And there's no question that heart health can lead to better brain health, right? I think we'd all agree with that. But I'd suggest, and I know this isn't a surprise to this group, but I would also suggest that brain health also improves cardiovascular health. You can't have physical activity, exercise. You can't be successful in engaging in it or maintaining a regimen without maintaining brain health, meaning both neurological health, but also mental health. And so I think it's important for us to remember this bidirectionality between the heart and the brain, and that it goes back again. So just if you don't mind, one study that came out within the last few years was really interesting. It showed that about 10% of the benefit of exercise on reducing clinical outcomes like heart attacks and strokes and so forth. About 10% of the benefit was mediated through the effects of exercise on the relationship between the amygdala in the brain and cortical thickness. So the amount of amygdala size and activity, reflecting sympathetic nervous system function, so that basically when you exercise, you improve your sympathetic outflow from the brain that then has an impact on your cardiovascular outcomes. And part of it may also be just the changing in thickness of the brain, of the cortical ribbon, may enable people to have better executive function, improve their ability to adhere to a exercise regimen or to remember to take their medications and so forth. And so I think it's very interesting that physical activity improves brain health and structure. It changes the structure of the brain, and that then leads to better cardiovascular outcomes too. So the two are inextricably linked. And I think that tells us that we can't do, let's say, exercise physiology or public health programs around exercise without taking neuroscience and the brain into account as well. And I'd be curious whether, the others, being neuroscientists, I believe, working in this area as well, have thoughts about that.
José Luis?
I think that obviously all of what is said today is obvious and very interesting, and we all know how to do it. But the point is that we have to have a roadmap to convince the public institutions and health management systems, and even ministries of economy and labor, to mediate our suggestion into practical laws. This is the thing I had to do it. We have to convince public institutions, and we should have a roadmap. So I don't know if going to bottom up or vice versa. So I don't know if we have to begin with the European Union or whatever, or institutions in America and going down, or we have to begin with city governments and then going up to the European institutions. But we should have a roadmap, because if not, let me say, with all my respect to my colleagues and all of you, that we are all the time experts in the benefits of the exercise, trying to convince the other people that is already convinced. And what we have to convince is the public institutions. So we have to have a roadmap of who to contact first and what to tell them and how and what is the relevant people. Because when we are there, when we have the politicians in front of us, we know perfectly what to tell. All the things that we are talking about today. So we know what to tell, but the problem is who.
Can I propose a challenge, or just to be contrary in some ways? I think about the issues with obesity, right, and the difficulties people had losing weight. And for years and years, we said to people, it's an individual choice, and it's willpower, and you have to lose weight, and we never had any success, and obesity rates have been climbing and climbing and climbing. And then along came a medication, and I think Jose Luis, maybe you referred to the GLP-1s, or maybe it was Felipe, but then there's a medication available, and obviously not everybody has access to it, but to some extent, a fix came along because it had an impact on the brain and on the gut and so forth. The mechanisms by which GLP-1s reduce weight and help people with eating less may not even be fully known. But of course, the benefits, I think you showed that if people lose weight, they actually want to exercise more. And so, at some level, perhaps, I don't subscribe to this, but I'm proposing, just to challenge you guys, that maybe it's just a question of the medication. Maybe we need, the medication that makes you exercise more, and then all of these systemic, structural city hall things won't be needed. You just need to prescribe drug X that makes people go out and run. Is that going to happen?
Might be.
We will invest money for sure if there is a startup on that. So thank you very much. Let me just Jürgen.
I want to follow up on Mitchell and Jose Luis' points. I think, Jose Luis, you mentioned that we need to have a national roadmap to be able to really put physical exercise on the move. As you know, in Spain, there is this Spanish Brain Plan, which has been approved in July 2025. And then we are in close collaboration with the Spanish Brain Council to really push forward these lifestyle changes. And aligned with what Mitchell is saying, we need to have a holistic approach, also integrating not only the cardiovascular aspects or benefits from exercising, but also the brain aspects and neuroscience perspective. So
this is really good. I was the president of the Spanish Brain Council for years. So exactly before the president, that is Mara Dirsen, now in Barcelona, and I can contact her just to promote this. But even we are, because of the presidents of the Spanish Brain Council, myself and now Mara Dirsen, and in close contact with the European Brain Council. So we can move forward these strategies accordingly, all the national brain councils across Europe.
Jose Luis, this is exactly what we have discussed with Mara. Unfortunately, today she was actually invited to this webinar today, but she couldn't make it. But clearly, our webinar will be a follow-up with her. So it would be really great if we can have a meeting to push this forward, because in reality, there are many aspects within the Spanish Brain Plan and also within the regional government here in Catalonia to move forward into this direction. So yes, I absolutely agree with you. And that's why I wanted to pick on your idea of national roadmap to put really a focus and emphasis on changing lifestyle, and on the top of this, particularly on physical exercise. And I would like to launch one question, if Enrique allows me, how do you see the whole concept of dual task exercise, which is really connecting exercise, body exercise, and mental exercise, mental stimulation. So how do you see of this strategy as the way forward, in fact, to tackle aspects related to the body, but also to the brain? Whoever wants to take the question, maybe José Luis or Felipe.
Yo, si me permitís, simplemente responder una opinión muy personal. Tenemos muy claro los beneficios del ejercicio físico, y la ciencia, y José Luis lo sabe perfectamente, ya ha demostrado hace muchos años los beneficios del ejercicio físico a nivel cerebral.
So, as a personal opinion, we know the benefits of exercises, and science has already demonstrated the benefits of it at a cerebral level, at a brain level.
Por lo tanto, podríamos perfectamente estar hablando de los diferentes beneficios en los diferentes sistemas corporales, pero creo que no vamos a avanzar en gran medida, ¿no? Sí que estoy muy de acuerdo en que evidentemente hay beneficios cerebrales y eso ya lo ha dicho la ciencia. Entonces, yo no distingo entre cuerpo y cerebro, es decir, los beneficios son múltiples. Es como si estuviéramos diferenciando sistema óseo del sistema esquelético, del sistema cardiovascular. El ejercicio físico es un medicamento tan beneficioso que influye en todo el cuerpo, incluido evidentemente el cerebro como parte corporal.
So at the end, physical exercise influences or benefits the whole body. And as the brain is a part of the body, this distinction between the body and the brain feels a bit artificial.
May I comment as well? I absolutely agree, and I'll just recognize that just this summer there was a clinical trial called the U.S. Pointer Study published, which was a large trial that the Alzheimer's Association sponsored that showed that a multi-domain intervention, including recommendations for exercise, but also including mental exercise and other risk factor control and nutrition, led to improvements in cognition, or essentially slowed cognitive decline. The effect wasn't enormous, and I think we still need to find out which of the specific interventions in that multi-domain intervention had the biggest impact. No question, I think physical activity is going to be a major driver there. But I think my sense is that the field of kind of preventing cognitive decline has moved to thinking in terms of these multi-domain interventions. There's not going to be a single drug, as I was kind of, perhaps facetiously alluding to earlier, that's going to make all the difference. We have to approach it just like we think of these problems as being holistic and the body as being holistic. The interventions will need to be holistic to have an impact. And it may be that some things, exercise work for some people, mental activity works for others, nutrition works for others. There's so much more to learn about this, I think, before we can say for sure.
Great, thank you very much. Let me make some questions. Still, we have 8 minutes. First, in fact, to Mitchell, I would like to make the following question. Here in Catalonia, there is a bit, let's say, reason. Well, let's say not reason, but let's say the last, attempt, and Felipe knows very well about this program they want to launch on physical exercise prescription in the healthcare system, especially in primary care. However, I had the chance to speak with different people that are supposed to be involved in this program, and they were, let's say, identifying that even though the program is pretty detailed in terms of the measures, with regard to the implementation, it's actually very difficult to move forward. First of all, because of the complexity of the implementation of such kind of programs, as you need to articulate the coordination of different professionals in the healthcare system. So on the one hand, doctors, also with physiotherapists, and eventually with personal trainers. And not only this, but also to have a, let's say, very clear, commitment or agreement between the public and private sector with regard to the sports and fitness centers, in order for them to be also involved. And in order to articulate this, a second very important issue is that there is budget normally coming from the government. And here is a major challenge, major issue. I would like to know about your experience with regard to this type of challenges as regards the implementation of the prescription of physical exercise in your country, the US.
Well, again, I don't think any of these things are simple. I think what I can speak a little bit more towards, for example, nutrition and dietary changes. So a big initiative of the American Heart Association has been, we talked about exercise as medicine. We have a big food as medicine initiative where the idea is to provide healthy food to people who don't have access to it. And of course, we do that within the context, again, of a more holistic coaching program. We don't give food to people without recommending exercise and physical activity as well. And the approach we're taking to our Food as Medicine initiative that I think is also relevant to exercise as medicine is to use these behavioral economic principles. I mean, I'm a neurologist, I'm a physician. I'm speaking to the Euro-Mediterranean Economists Association. This is, I think, like your guys' comfort zone, the behavioral economics. But the colleague I mentioned earlier, Kevin Volpe, has emphasized the importance of these kinds of nudges, incentives, establishing the choice architecture and the opportunities to facilitate these, to both make these kinds of programs that you're talking about possible, and also to make them as effective as possible. So if you're going to put resources towards some kind of program, maybe where people meet with physical therapists, you want to maximize the success of it and do it in such a way that it can work as well as possible. And that might mean, adjusting schedules, for example, or using a certain, doing more research to find out what are the best and most cost-effective ways to do these kinds of things. That's what I would say in general about how to go about it. But I don't know the perfect solution yet.
I want to follow up on your point, Mitchell, because you clearly mentioned that we need to have more studies on behavioral economics. And this is very clear to me, to change the incentives and then to ensure that people also have the incentives to do more movements within their environments for their own health benefits without being prescribed or not to do more exercise. And this is also aligned with what Felipe Isidro mentioned on we need social demand. We need to increase the social demand, enhance the social demand, but at the same time, within the right or appropriate environments. And this is what I call the health, or I would say healthier cities, but more active cities, or more greener and more active cities, because we need the nature. We mentioned that it's clear nowadays there is evidence that the more exercise you do outdoors, it has much more benefits. But then at the same time, we need to put the right incentives through, for example, this nudging strategy, but also, I don't know about giving financial incentives. I do not know about this. As an economist, I think we need to have the right incentive within the behavior, rather than really just giving money for you to do exercise, which is okay. That's why I wanted to see with you, Mitchell, how do you see the other sectors within this national plan of physical exercise that you mentioned, for example, education, not healthcare, education. How do you see a parallel? Do you think there is a need for the same nudging procedure, or eventually the incentives are different, or there is no studies on that? What do you think about that?
Well, with regard to education, I think it's mostly for youth, children in primary schools, secondary schools, making sure that they get adequate time for exercise and activity. And there, even with financial incentives, there are studies, in fact, around financially incentivizing children to eat properly and exercise and lose weight. And they have shown some evidence of benefit. I think we need larger studies. They don't necessarily, it doesn't require huge amounts of money for children, but these kinds of incentives, or it could be other types of incentives. They don't necessarily have to be financial. It could be greater, more time at recess or less homework. I don't know. It could be, there are other ways to incentivize people. that could improve those kinds of outcomes. I think that the principles are the same regardless of the the cost of the intervention, perhaps. And it may just be how our healthcare system works in terms of insurance and so forth. Everybody's paying for their health insurance here below the age of 65 at any rate. And so if they can, get a lower premium that's equivalent to paying them a financial incentive, that could make them more likely to exercise. We've done the same thing with smoking. People get lower health premiums if they don't smoke, for example, and it's been shown that you can reduce smoking rates by using that. So, I think the same applies perhaps to physical activity.
Felipe, me gustaría hacer una pregunta. I will do it in English and in Spanish, ¿vale? En primer lugar, quería preguntarte, son dos preguntas en una. Me hacía referencia a la importancia de generar esta obligación, ¿no? de hacer estos test de funcionalidad física. Quería preguntarte esto como si tienes, de alguna manera, ¿cómo lo visualizarías? Es decir, ¿a través de qué manera se podría trabajar en esa línea? Es decir, no sé si podría en un momento dado plantearse que dentro de los centros de medicina, de los CAPs, los centros de asistencia primaria, o en otro tipo de sectores. Y la segunda pregunta es en relación también a tu visión en cómo, teniendo en cuenta que, como explicabas, la idea de los snack exercises, es decir, esos pequeños espacios de actividad física o de ejercicio físico, es algo que puede ser útil. ¿Crees que habría alguna manera de articularlo a través de instituciones?
Es más fácil la primera.
I speak to English, sorry, very fast. My first question to Felipe is that how he envisions the possibility of making compulsory these type of tests on physical functionality he was referring to. And second, also how he envisions the possibility somehow of articulating the implementation of the snack exercises to which he was referring, as they are kind of useful and in that sense very short. That is the question for him. Thank you, Felipe.
Gracias, Enrique. Es más fácil la primera pregunta. Luego respondo a la segunda. La primera, en cuanto a los test. Igual que hay otras pruebas obligatorias dentro de la actividad sanitaria, es decir, por ejemplo, las vacunas en los niños y adolescentes, o las revisiones periódicas que se hacen en educación primaria en los adultos, dentro de esos protocolos sanitarios debería estar también un test funcional adaptado a la edad biológica de la persona.
So, first of all, to the first question, there are other mandatory tests in healthcare that already exist, like vaccines for teenagers and children. So within those protocols, there should be functional tests of functionality of individuals integrated in these protocols.
Y incluso también en las escuelas, evidentemente, no solamente en niños pequeños y adolescentes, sino incluso a nivel universitario. En todas las etapas docentes debería de haber también la obligatoriedad en algún momento del año, o una o dos veces al año, de realizar unas pruebas y tener una base de datos con los resultados de esas pruebas, ¿no? Que permitieran conocer cómo están las personas.
And also in schools all throughout the education period, so not only in younger children, but also in universities, there should be these mandatory evaluations once or twice a year so that individuals can know their status regarding body functionality and physical status.
Y en cuanto a los snacks de ejercicio, hay dos posibilidades. Una es la propia voluntad personal de incorporarlos en la vida de alguna manera no laboral, y otra sería que las empresas permitieran ciertos momentos cada hora donde los trabajadores pudieran realizar esos snacks de ejercicio.
And then regarding the snack exercises, there would be two possibilities. The first one would be regarding the individual will to incorporate these exercises in the non-working life. And then the second option would be for companies to allow workers to do these exercises, these NAC exercises, every hour or so.
Gracias, Paula.
De nada.
Okay, so I think we are coming to the end of this webinar. So I would like to thank all of you for sharing your information, insight about this very important topic. I was exchanging also with George, who will, of course, is a partner of the Euro-Mediterranean Economics Association, and we are all part of this World Economic Forum Brain Economy Action Forum. So we will continue our discussions on the importance of physical exercise adherence and toward movement-enabled societies. Of course, we need to have an integrated approach, as pointed out by Mitchell and all of you, and at the same time, a national roadmap, national strategy. In reality, in the case of Spain, there is a national brain plan, which we could use it as a national strategy to promote a culture of exercise and movement, but of course in collaboration with other disciplines. So this will become really a coherent, integrated approach within this plan. So we continue working within the brain economy on promoting these strategies and a system change toward more enabled societies and proactive and healthy societies, particularly in terms of brain health. And then, for sure, thank you very much for your contributions. And at the same time, we will have our reports of this webinar together published in the next couple of weeks. And then we will give you more information on our next events on the same brain economy topic. So thank you very much, and thank you, Enrique, for moderating this discussion.
Ciao. Yes. Bye.
Thank you. Bye.
Thanks very much. Bye-bye.
So, Rim, read the message that I sent.
Oh, okay. Let me read it, because before just if you can, we are not anymore. Okay, no, there on the message. Okay. Yes, perfect. So we can have a meeting, Jose Luis, probably with Mara, and then we can discuss a little bit how we take all of this forward.
Okay.
So when